To review what we learned about in this module, we learned the calculations for total body water with males having about 0.6 milliliters per kilogram and females having 0.5 milliliters per kilogram. We talked how to calculate osmolality and the osmolar gap. We talked about how to evaluate current volume status, including the signs and symptoms of hypovolemia and hypervolemia. We talked about those general complaints that patients may have, like for hypovolemia being dizzy or fatigued or having cramping. And then in hypervolemia, some of those symptoms being exertion, dyspnea on exertion, having shortness of breath, leg edema, and weight gain. We talked about physical exam and some differences there with having resting tachycardia with hypotension and hypovolemia, and patients complaining of those symptoms of fluid overload in hypervolemia, but they can be either hypo or hypertensive in that state. We talked about laboratory values to keep in mind with that BUN to serum creatinine ratio of 20 to 1 in the hypovolemia, and then having an elevated BNP in patients with hypervolemia. We discussed the difference between crystalloids and colloids, with crystalloids being small electrolytes or molecules suspended in water versus colloids, which are larger. Crystalloids are less expensive and have less risk for anaphylaxis or infection, versus colloids, you do have that risk. They're more expensive, but they do spend more time intravascularly, requiring less volumes compared to crystalloids and less risk of edema. We talked about how and when to use each of these types of fluids, including the specific crystalloids such as D5, NS, and LR, and talking about when to use albumin. Then we went through the maintenance fluid calculations, remembering that calculates your total fluids per day, either using the Holliday-Seeger equation or that 30 to 40 milliliters per kilogram per day.